Premenstrual stress syndrome. The main reason for the psychological stress that some girls experience before their period. Is this sentence an allegation that some girls claim to justify her mood and intensity? Why doesn't it affect all girls despite the similarity of their hormone levels? In fact, changing hormones between high and low affects chemicals in the brain, including serotonin, which affects mood directly. But what is the reason that only some girls are affected? The reason is their body's extreme sensitivity to changing the natural ratios of hormones. This is what we call premenstrual stress syndrome. Are you thinking now how you can tell if you suffer from this syndrome? Some symptoms will tell you. Swelling in the abdominal area, which makes you feel very uncomfortable and heavy in movement. The girl notices a slight increase in weight due to the accumulation of fluids in the body. Hypersensitivity in the breast area. The girl complains of pain sometimes, especially when touched. Unexplained bouts of crying. Feeling of increased hunger and greed. Depression and irritable. Social withdrawal and anxiety. Changes in sexual desire. These symptoms are more common in girls of fertile age because of their close association with ovulation. From here, we discover that there are 3 groups that do not suffer from this syndrome, and they are: first, very young girls. Second, pregnant women. Third, women who are close to menopause. It is not possible to confirm the occurrence of this syndrome except after synchronizing the appearance of symptoms during the 5 days before the menstrual cycle, and its end within 4 days after the start of the menstrual cycle, and repeating this for 3 menstrual cycles. Now, what can you do if you have these symptoms? The daily stress and anxiety exacerbate these symptoms, so the results of treatment depend on the nature of the woman and her lifestyle. Yoga helps relieve stress and relax, as it is a suggestion that you should try. Exercising continuously for at least half an hour, 3 times a week as a minimum. Paying attention to food, reducing the intake of sugars, and increasing foods rich in vitamin B6, such as eggs, chicken, fish and liver, as a means of relieving these symptoms. Sleep at regular times and for a sufficient period of not less than 6 hours. Sometimes educating and supporting women helps in relieving symptoms, as if we remind her that she is not the only one who suffers from this, but many like her. Finally, if these symptoms worsen and begin to enter the phase of severe depression, it is necessary to consult a doctor, who may resort to appropriate drug treatment. And finally, always remember that you overcome menstrual pain every month and return with your radiance and vitality to resume your life, as you want it.